Thank you. Well, according to the CDC, flu cases are on the rise across the country and right here in Connecticut.
Our colleague, NBC Connecticut's David Horowitz, joins us live in Bloomfield with the very latest. David?
Yeah, that's right. Good evening, Amber and Kevin. Now, what we're hearing is that this is not only impacting young children, but also the elderly community, specifically here at the Doncaster Elderly Home in Bloomfield.
We have seen a significant spike in the number of kids that are coming to our emergency department.
Dr. Juan Salazar, an infectious disease specialist at Connecticut Children's, tells us some common symptoms of the flu are high fever, persistent coughing, and being out of breath. He says we have not seen a surge like this since 2009 to 2010.
There have been 13,000 deaths in the U.S. This year, between 24 and 25, associated with influenza, and that's a problem.
Fortunately, Dr. Salazar tells us the flu does not have a high mortality rate for children, but 57 children have died from the flu across the country so far this season, none of them from Connecticut.
It can affect the kids' lungs, can get secondary infections, and some of them can end up in the hospital in the ICU.
He says be sure to wash your hands frequently and do your best to avoid being around sick people.
I don't want people to panic about this, but it's something that we can prevent severe disease by vaccination and proper isolation when we need to.
Despite the rise in cases, it is not recommended you get more than one vaccine a year. And while young people are being impacted by the virus, the elderly population has been hit hard too.
Our residents are very vulnerable. They're elderly, they're in their 80s, their 90s, and they really get hit hard with the flu.
Pellegrino says it is the lingering effects that can cause the most issues.
It seems that this year is the year that they're really needing that extra little bit of nursing help afterwards.
And Dr. Salazar says that if your child is symptomatic, not getting better, you should probably take them to the emergency department. There they can be treated with things like antivirals. As for the elderly populations, Pellegrino tells us that if they are feeling symptomatic, that they shouldn't be meeting with their grandparents or whoever it may be. If it's absolute emergency to meet with them, that it's best to mask up. In Bloomfield, David Horowitz, NBC Connecticut News. Kevin, back to you.
David.